the infamous cancer-related stressors. Biopsies, waiting, lab appointments, scans, my God, more waiting, surgery, doctor's visits, chemotherapy, nurse checks, radiation, and the side effects. If you have heard the words, "you have cancer," then you've probably felt the distress from some or all of these stressors. So does it really help when someone, even if genuinely well-meaning, says, "Happiness is a choice," or "God only gives us what we can handle"? Probably not. I'm cancer physical therapy specialist, Dr. Leslie Waltke, and welcome to the Recovery Room, a question and answer platform specifically for cancer patients and survivors. 2 points I want to discuss with you. Number one, a study done several years ago compared two groups. The first was asked to hold their arm in a vat of ice-filled, ice-cold water for as long as they could tolerate the pain, while sitting there quietly. The second group was also asked to stick their arm into the vat of ice-cold, ice-filled water for as long as they could tolerate the pain. But this time, this group could holler, swear, and complain. Guess which group was able to tolerate the agony of the ice bath longer? You got it, the swearing and complaining group. Now, yes, being positive and grateful and mindful is beneficial. However, that doesn't mean that it's not okay to spend some time expressing frustration, fear, and anger. You don't get any bonus points for ignoring those symptoms and pretending you're fine. The point is, during cancer treatment, the people who take a prescribed sleeping pill if they can't sleep, a prescribed anxiety pill if they're anxious, or a prescribed pain pill if they're in pain, their cancer responds to treatment just as well as those who tough it out. Taking on the added burden of trying to constantly be positive and a superhuman doesn't add value and can just wear you out. Allow yourself to be real. Point number two. The stress or stressors in our lives are often unchangeable, especially when compounded with a cancer diagnosis. No matter how much you sit on a yoga mat or squeeze a stress ball, you still have to pay the rent, get the kids to school, get the lawn mowed, make the boss happy, and go through cancer treatment. However, the corresponding distress you feel from that stress, that can be variable. The National Comprehensive Cancer Network estimates that nearly all people going through cancer treatment will feel at least some distress, and 33% will feel extreme distress. But only 5% of people with cancer will get psychological help, and that is not okay. Managing the distress you feel is critically important. If you are feeling overwhelmed, overly emotional, overly scared, or are not able to feel the joy in your life, talk with your primary doctor, cancer doctor, or nurse about helping you find ways to decrease the distress you feel. Seek out peer support or counseling. Schedule in recreation, exercise, and playful time with your loved ones. Know that talking about bad things does not make them more likely to happen and can actually make you feel better. Crying can make you stronger. See a cancer physical therapist to get you on a good exercise prescription. Being stronger, more flexible, and fit will help you trust your body again and will help skyrocket your energy and confidence. Make it a priority to get the red out of your thermometer. Surround yourself with good people. Care for yourself like you are the most important person on this planet, because you are. And exercise like your life depends on it, because it does. Thank you for joining me in the Recovery Room. I'm Dr. Leslie Waltke. Let's talk again soon.